Hello, my name is Mona Pearl Traybaum. I'm the Specialty Director of Veteran and Military Healthcare Academic Programs at the University of Colorado College of Nursing. And I'm here to tell you a little bit more about this specialty and how it came to be. So my background is in both the military and academia. I've had about 30 years as a nurse and over 22 years in the service. I started as a nurse. I went into active duty full-time, then went into the reserves, and then my last two tours were fully activated. During the time that I was in the reserves, I taught in different universities and had a great career in academia. While I was in the military, I had the privilege and the honor of really being able to perform in many different positions that gave me a great view on the whole system. So I started as a staff nurse and a trauma nurse, ICU nurse, went into flight nursing. I worked for the Surgeon General, did international health. I did some education. I was a squadron commander. And then the last two pinnacle, or maybe the last three pinnacle positions that I got to do was as an inspector general, really benchmarking programs across the whole enterprise, working as the medical director for the Air Force Reserve, writing policy at the Pentagon, and then working for the Secretary of the Air Force as a medical advisor, really looking at the exceptional specialty problems, issues, cases that would come before the Secretary. So that all of those things really served to give me a great view of the system, from whether it was from as a nursing frontline medical personnel, or whether it was as an educator, or as a commander, as an inspector, as an administrator, as a policymaker, and then as an advisor. So all of that really informed me to show me that we have this really robust healthcare system. And there's a lot of unique conditions that really pertain to our servicemen and women and our veterans. I was also married to a man in the military and saw him come and go back and forth to the home front, and he was in special operations, and saw how that really affected him and the family, and eventually really disrupted our entire family system. So I had the family perspective. And then finally, I was a patient in the system. So all of that really gave me the opportunity to say, we have a really unique population and a unique delivery system, being a one-party payer system. So when I retired from the military after 22 years, I brought this idea to Colorado, and they had really at the forefront of innovation decided to go for it. So we have the first veteran and military healthcare degree program as its own specialty area. When I started all of this, I looked at it and I said, what is a specialization? And is veteran and military healthcare truly a unique area? I looked at what is a clinical specialization and saw that medical specialization has really existed in one form or another, going way back to Greek and Roman times, and that it's gradually evolved and changed over the years, and that even internationally our specialties can vary, sometimes seem arbitrary, but can also be very specific. So some categories of specialties is it could be holistic, like family practice, or systems-based, like cardiology, or a technique-based, maybe like surgery, or diagnostic, or disease, or age, environment, or population. And as you see on the screen, here are some of those examples. And specialties can overlap. You can have a geriatric cardiologist, overlapping age and a disease or a systems-based area. Military medicine or medicine related to our military members and our veterans can either be population and sometimes environmental, as our military members in their training and when they go to war are truly in a very unique environmental position that affects their health and then creates service-connected conditions. So looking further at what is a clinical specialty, how do you get recognized as a clinical specialty? Here are some of the factors that I see in both medicine and nursing. Has to be clearly defined, has to have a well-derived knowledge base. Well, I can tell you, if you Google PTSD, or put into the PubMed, you can get several 100,000 articles. So I can say we do have a good knowledge base, can identify a need and a demand for ourselves. Well, as you'll see in one of my next slides, we have a huge need and demand, and with over 30 million potential beneficiaries in our system. Our nurses, our doctors, our healthcare personnel, they adhere to licensure, certification, and education requirements of their profession and their specialty areas. We have defined competencies related to taking care of the unique aspects that relate to military medicine or to taking care of our veterans. We have mechanisms to support, review, and disseminate our research. But one of the things that really stood out to me is that we don't have defined educational criteria or specialty preparation for a graduate degree. So this is where developing the academic degrees really comes into play. We definitely have continuing education programs. You can see that this is practiced nationally or internationally. We have a substantial number of practitioners, and we have specialty organizations. So just looking at the USA, we have over 30 million potential beneficiaries, our need. We have over 120 licensed healthcare providers in the MHS and the VA. And our two largest healthcare systems, which are single-party, government-supported, and congressionally legislated systems, have over a $200 billion budget a year, over 200 medical centers, and literally to make change is an act of Congress. But we don't really train people in how to make this act of Congress or how to make this happen. A little snapshot of the VA. It's one of the largest civilian employers in the federal government and one of the largest healthcare employers in the world. Over 269,000 employees. So you can see we have a huge number of practitioners really focused on this population. The VA, again, is spread out through the United States with over 150 medical centers and many outpatient clinics, community-based centers, independent centers, vet centers, domiciliaries, really creating this huge health system across our nation. So some conclusions after doing interviews and focus groups and brown bags and talking with many people is that there is an identified need and demand. There is a discrete body of knowledge. We do have research which supports a specialized knowledge base, and there is a substantial number of practitioners. And it's not just the US. We also find this in many other countries that have militaries and veterans. And we are definitely represented by national and international associations. And just taking a quick look at military medicine and practice, you can see it looks very differently. But it also gives you a clue at some of what our veterans experience when they reintegrate back into society and move into the VA system. So at the University College of Nursing, we had this vision for veteran and military health initiatives in academia. We had an education component, a research component, and a practice and partnership collaboration. For the research, we've actually now established a veteran and military health care area of excellence, and our community providers have integrated into that area, our students, our academics, and our research partners. We have a practice and partnership collaboration, and then I am spearheading the education initiative at our college. So we have graduate education. We have 6 specialty courses that have been approved. The first course started in January of 2015. We have a graduate certificate in veteran and military healthcare, a Master's of Science in Nursing in veteran and military healthcare, a postmaster certificate, a combination MS and PhD, and a PhD emphasis area. All of our courses are delivered online. The courses are interprofessional and open to all healthcare providers. Our faculty is a collaborative team from the VHA, the MHS, academia, and our community. The specialty courses that we have defined are these 6, and then I'm going to talk about each one of them individually. So the first one is military and veteran healthcare systems. Sort of alluded to this in the past, that we have a very unique system because it is congressionally mandated. It is a one-party payer system. This course looks at the socio-political, economic, ethical, and current national healthcare issues confronting the veteran and military healthcare delivery systems. We look at overall structure, the function and processes, and the influence of these contextual elements on the policies guiding, regulating, and organizing the delivery of services. That's sort of a mouthful. It's a huge system, and we provide a lot of care, and there are many different unique aspects to it. Having worked at the Pentagon and actually had the opportunity to write policy that made it from our office through all the wickets at the Pentagon and every single service and the overall joint services, went to Congress, was approved by Congress in the NDAA, and then was actually appropriated and funded. It sounds like a really long process, and it is a really long process, but that happened in 18 months. So I want to say it can happen. I've had the experience, and I've had a good experience with it, but I know it can be really frustrating, and people really do need to learn how to innovate and make change and work with the policies that guide and regulate this system of care. The next course, and to me this is probably the most foundational course in our curriculum, is Home from the Battlefront, Psychological Healthcare for Veterans and Service Members. And the premise of this course is that to really provide holistic care, we need to understand our veterans. We need to understand our service members. We need to appreciate their identity, their culture, what makes up their psyche. So this is an introduction to veteran and military culture and really a historical perspective of all the different types, all the different conflicts over time. We can go all the way back to Greek and Roman times, and then looking a little bit more in depth at things that are closer in the last 50 to 100 years. We explore post-traumatic stress, TBI, suicidality, and the effects of psychological health on the family and parenting from the perspective of the veteran or the service member. And we do this not just based on the USA, but we also try to integrate national and international other militaries. Really saying internationally, is this a problem, or is this in the US? Or do other cultures and other countries deal with this differently? We look at issues related to diversity, reintegration, redeployment, healthcare, navigating healthcare, and ethics. So another jam-packed course, but really necessary to understand our veterans and our service members in order to provide them the care they deserve. And because our veterans are not alone in this world, we have the course of On the Home Front, supporting our veteran and military families, looking at the dynamics and attributes of the families during and after service. We explore issues of deployment, reintegration, parenting, compassion fatigue, and living with the sequela of combat stress, whether that be family violence, suicide, homelessness, or PTSD. And even the positive aspects, which aren't in this little blurb, but there's also adaptability and resilience that gets built into these families. We evaluate the preparation of civilian providers and family care interventions, because as the service member moves out of the military system and into the VA system, the families are served in the community. So it's really important for our civilian providers to understand some of the unique aspects that our families face. The fourth course is Wounds of War, Military and Veteran Disability Evaluation. And this is a detailed examination of the Military Veteran Integrated Disability Evaluation System, including the process, policies, clinical condition, and some complex case studies. The Integrated Disability Evaluation, IDES for short, is a two-edged sword. It lets people know if they're fit for service and can remain in the service and actually medically ready and fit to serve. But it also is going to be access to care and defining the service-connected conditions for veterans to get care in the VA system. This course also looks at the benefits associated with service-connected disabilities and conditions. What are the special considerations for our reserve and guard members? And how can we assist in preparing for this evaluation and appeals? It is a very convoluted system, and again, based in law. So we look very closely at the laws that are on the books and that have evolved over the last 50 to 60 years, and how some of it is antiquated. But how can we modernize it so that our servicemen and our veterans really are able to get the care and access to care that they need? The fifth course, Women in War, really infuses a humanities perspective into the curriculum. This course was developed with faculty at the Health and Behavioral Sciences Department and the Department of Anthropology. And we look at roles of women during war, what are some of the gender-specific policies, deployment considerations. We also look at reproductive and urogenital health, military sexual trauma, and the psychological effects of deployment that may be unique to women. We appraise women's experience, their roles in the family, reintegration, and some of their selected issues. So this is a more in-depth look in terms of diversity, reintegration, a subpopulation, but a growing population of women in the military or women who serve, whether it's on the home front or civilian women, and how they're related to what happens with our militaries when they go to war. The final course that was built in this curriculum is Caring for Veterans, Chronicity, Aging, and End-of-Life Care. And this was developed because of a need where we saw with our geriatric population. And as our veterans age, they have specific conditions and specific service-connected conditions that as they age tend to express themselves differently. So we explore aging and chronicity in our veterans. What are the effects of the environmental exposures that they had in military environments, such as maybe Agent Orange? What are the long-term effects of being exposed to CBRNE, chemical, biological, radiological, nuclear, and explosive materials? A lot of the training environments may have some of these elements. We examine specific service-connected conditions for veterans of Vietnam, Gulf War, and Iraq, Afghanistan. And then because being a service member becomes such a part of a person's identity, we really look closely at end-of-life care. And what can we do to support our veterans as they pass from this world to the next, or as they pass on, how can we support them at the end of life and help them find meaning at this time? So I love all of my courses, but this really has hit home the more and more that we've worked with this class and seeing what happens with the different eras and as our population ages. All of these courses work together and can be taken in different ways. We have a graduate certificate that is online. It is interprofessional, open to any personnel who have a baccalaureate degree and work with the veteran and military population. It's 12 credits, and you take 4 of those 6 courses that I just discussed. The only one that you must take is the psychological health care, because that's the basis of really understanding the psyche and the culture and the individuals that we're caring for. The Masters of Science in Nursing is open only to nurses, and it's in veteran and military healthcare is the unique specialty. There's an MSN core of 12 credits. You have the core from the VMHC, 18 credits, and a 2-credit practicum. That's 90 hours that you do in your practice area, in an area of your choosing. And this is really a win-win for the preceptor and organization where you do this work, and you get to actually create an innovation and do something that's going to be helpful to the population. A postmaster's certificate in nursing. This is basically a second Master's of Science degree for nurses. There's no need to take the MS core because you already have a Master's in nursing, but you take the VMHC core, which is 18 credits, and the practicum. So that's a 20-credit program. We also have a combination Master's and PhD where you apply to both programs. And if you're accepted to both programs, we use the PhD research courses for both programs, and we use 9 credits of the specialty courses for both programs, and you receive a savings of 17 credits. There's customized plans of study that are available online. You can also do this in tandem. You can start with the master's program and then move into the PhD, and then you can still move 9 credits forward into that program. So it's a nice option to have if you think that you want to take this route. We have a PhD emphasis area, so if you are in the PhD program and you apply to that, you can take 9 credits in the VMHC specialty courses, and that will be used in place of the electives in that area, and your dissertation and coursework will be focused on the veteran and military population. So you would take the courses that most support the dissertation work that you want to study. The DNP, I've been asked about this a lot. It's in the works, it's coming soon. We have a combination of our VMHC MS curriculum and the leadership DNP. It would be 70 credits, and it's really a focus on leadership and administration in the veteran and military healthcare systems. So some financial information. A lot of people want to know the bottom line. Right now, our cost per credit hour is $635 a credit. The cost increases by a small percentage each academic year. Each one of the 6 specialty courses are 3 credits each, and the practicum is the only thing that is 2 credits. Federal financial aid is available for students in the degree programs. Most of our employers will provide tuition reimbursement. The military has tuition assistance, the VA has continuing education funds, and the VA also has an NNEI scholarship that covers the entire program. You can find more information online at nursing.ucdenver.edu/VMHC. Application information. Our degree programs, you need to apply via NursingCAS. Our postmasters is also via NursingCAS. But our certificate program, you apply directly to our College of Nursing Extended Studies and Professional Development program area. And the same with our individual courses. And then Nexus, we also work with Extended Studies and Professional Development and with the Nexus office. And again, you can find more information online. Here are some links if you actually can download these slides. And then some things that our students say. So at the VA, this is their words: in order to move up and to get to a Nurse 3, one must be published. In order to get to a Nurse 2, one must submit an innovative idea to the team. And she said to me, I bet you can guess what idea I will be submitting, because all the work she did in her course, she was able to take and use at her job. And she said, this class has helped me so much in my career, not just in climbing the ladder, but also in understanding my patient. Thanks for the awesome class. And these courses have helped me in ways I cannot express, and I've changed my practice because of them. Some of the comments from the anonymous surveys at the end of the term: worked in the military 30 years and still learned so much from this program. Very impressed. This is needed in schools of nursing. Students have little idea how to work with our vets. It has helped to understand the VA process, service-connected issues, and all the things that need to happen to maximize benefits. In working through this certificate program, I've learned a great deal that has and will continue to influence how I teach new nurses and practice with veterans. This series of courses are invaluable to my area of study and line of work. Without access to these courses, I would not be as far along as I am now. Inspiring conversations with a larger class size were a plus for this course. Glad to see a robust number. Excellent job overall, and provided the most wonderful resources, so much so that I sent many of the links to my daughter, who is a new military wife and struggling with many of the issues presented in class. She is benefiting from the information and links. It has helped me understand her world, her husband, and the military life, and how I might be able to help veterans and their families more as a mental health practitioner, and how to advocate for them. I understand that I do not know a lot about them, but I've learned a lot, know where to look for more information, and how to advocate for their needs. These courses are gold for my area of research, as well as being highly applicable to my occupation. The class is small, but very engaging and a wealth of information, always lively and interactive. The course is well organized and on target for addressing the needs of veterans. This speaks well of University of Colorado, Denver regarding commitment to veterans. Dr. Pearl, that was before I got remarried, now I'm Dr. Pearl Trabaugh, is a truly exceptional instructor, finding ways to engage a diverse experience base of nurses, often finding important aspects which bring all to a greater understanding of issues. It really moved my research forward. And I have to say that me as an educator, I really want this to work for you. I want to see that it makes a difference in your practice, in your life, in your understanding, and can broaden your perspective. I have 2 videos from 2 of the students that are senior students at the completion part of their program.
Hi, my name is Allison Boyer. I work at the University of Colorado College of Nursing on the Anschutz Medical Campus. As a civilian, I have chosen this program to have a better understanding of our military members and the specialized care that they need. I have several family members that have served in the military and the police forces, and I've witnessed firsthand the effects that they can do both on their physical and psychological well-being as a person. The Veteran and Military Healthcare Program is truly tailored and personalized so me, the student, can focus on the coursework and the areas of healthcare for the veteran population that I'd like to have special interest for. Once I get into my specialized courses, each Canvas shell is set up and similar for each class. You know what to expect. The assignments and readings were all relevant, up to date. Most of the information is also downloadable, so you don't have to buy all of these expensive books. With our curriculum, we have both synchronous and asynchronous discussions, which is a really great way to connect with people that are across the country. It feels more like a classroom setup, and you have that personalized feel with your other classmates. We can interact and share screens and videos, reading modules, assignments, we can post on the discussion board. And again, as the courses progress, we can really get to know each other on a more personalized level. I've had the opportunity to be the first graduate of this program, so yay. And I've been able to conduct research under the direction of the renowned faculty of our nationally ranked programs. I'll use the information that I have learned, especially during my clinical hours and my community hours, to focus on the interventions that have both a positive effect on the psychological and physical well-being of our veterans. My final project was to focus on homeless veterans, and I was able to blend using interprofessional, interdisciplinary, nursing, social services, dietary nutritionists, and come together and work on a project at Valor Point, which is a domiciliary out in Lakewood, Colorado.
Very proud of Allison and her work with the community. So just one more video to show you.
Hi, my name is Sonia Barnes. I am currently a registered nurse at the Denver VA. My practice area is the gastroenterology lab. I was looking to further my education, and I was looking at the CU website and came upon this program. After I saw, the pamphlets and things, no more contemplation was necessary. I decided to go ahead and go for it. I may be a little bit biased as I'm a veteran myself. I just decided what better way to serve my fellow veterans than learning more about them. I just read this quote a couple days ago, actually, from an unknown author. So the quote went something like, a veteran is someone who at some point in their life wrote a blank check payable to the United States of America up and to the amount, including their life. So I work with veterans, and this statement alone makes me, it encourages me, motivates me, and drives me to learn how to better care for them. Besides that, at some point in your career, no matter what nursing path you take, you're going to encounter veterans. You're going to be responsible for their care. And personally, I would be thrilled if my care provider knew a little bit about veteran culture and what my background is. For me, it was a great learning experience in that I thought I knew a lot. Being in the military for 10 years, I thought I knew a little bit about veterans and military culture, but this whole program was definitely an eye-opener for me. Actually, scenarios and experiences that I had as a soldier, a lot were explained in this program. In addition, the things that veterans go through, the issues, the concerns, the trials, whatever veterans and their families go through, it was thoroughly explained, throughout this course. And like I said, it was definitely an eye-opener for me. Curriculum overall, I felt was very well organized. It was very well timed, meaning during a certain module, there were questions answered. You would kind of ponder over questions with your peers, and then you wondered what next. You had questions after that. So then you open the next module and your questions are answered. So that's what I mean by very well timed. Definitely this is something that I can take back and build upon. In my practice and my career, well, first and foremost, I'm my patient's advocate. The things that I learned here, I have full confidence that I can go back and kind of be the up-and-coming specialist, so to speak, in this area as far as my workplace. We just got a new manager, actually, and she just recently voiced concerns over knowing about the veteran culture. She has no idea. So I feel like it's my duty to teach her these things. I think the different eras of veterans and the different wars and the corresponding conditions that go along with those eras really enlightened me. They opened my eyes a bunch. Definitely that's something in your practice area, just knowing the different conditions that could exist with the different eras. I think the single most important thing to do is to ask questions, to really assess and ask questions, because a lot can be learned with simply by listening. And that's why I love working with the veterans now, is because I can relate somewhat. We have a camaraderie or a certain bond that nobody can understand unless they were a veteran. So I think this really unique population and caring for them is really important. It's important for people to learn more about them and their background and taking care of them.
Well, I hope you enjoyed hearing from the students. They make me very proud in their experiences and how they're able to care for our veterans, whether it's in the community or in the VA. Here are some contacts in the slides. Feel free to reach out to me. My phone number is on there, my email. We have a graduate advisor, China Hutchins, and she really advises on the MS, DNP, and PhD programs. Sarah Hyman is in our Office of Academic Programs of Extended Studies and Professional Education. So her purview is really the certificate program and individual courses. But I'm very accessible. Please reach out to me and ask questions. And if you're not even sure if maybe you can do it or take a class, try it out, see what you think. You always have that option. You can start a class at any time. There is a longer time to get into the degree programs because of our admissions process, but you can actually start the courses every term. We have 2 courses each term. So I hope you've enjoyed learning about this. It's been my pleasure to be here and tell you about the programs. And have a great day.